I'd like to say welcome to you all and thank you for joining us this evening for the second in its series, Questions and Answer COVID-19 Vaccinations. And as Brother Cassius mentioned, today our event is focusing on our brothers and sisters from our Black community. So today, the event has been organised by Black Country Near Neighbours, which comes under the umbrella of Transforming Communities Together, the NHS Black Country Equality and Diversity Board, and also JCARA. A lot of familiar names who are amongst us today, so thank you so much for joining us, but also some new ones too, which is always nice to see. So for those who don't know me, my name is Shaz and I head up the Near Neighbours programme across the Black Country, and I will leave a link on the chat for you to explore our organisation further. I would also like to take this opportunity to invite our partnering organisations to share some words with us. Equality and Diversity and Inclusion partner Yasser Mohammed from Black Country Healthcare NHS Foundation Trust. Please share some words with us to start the event.
Hi everyone, I've just been unmuted, I was muted. So thank you everyone for coming along today. My name is Yasser Mohammed, I'm the Equality, Diversity, Inclusion Partner working at Black Country Healthcare NHS Foundation Trust. And what we'll be discussing today is the disproportionate impact on BAME communities around COVID-19 and also looking at vaccine hesitancy and thinking about how we could break down some of those myths and barriers really to vaccine hesitancy. So that's what we're about really here today. I'm really glad to be working alongside Near Neighbours for that. So over to yourself, Shaz. Thank you.
Thank you, Yasser. And can I ask our next partner organisation, JCARA, Rupinderjit Kaur, who is the director of this organisation.
Hello, good evening, everyone. Thank you so much for joining us. As Sister Shaz have said, this is a series of events we are doing. This is the second. We just wanted to say that it's so important that faith leaders, community leaders come together and professionals joining hands to raise awareness that how important it is for us to have this vaccination in order to save our lives and other people. So I'm grateful to all the professionals, all the speakers, and all of you who are joining us this evening. Thank you very much. Over to you, Shaz.
Thank you very much, Rupinder. So as Yasser and Rupinder mentioned, the event is to raise awareness of the vaccination and combat some of those conspiracy theories and the myths that are out there. Now, before I hand over to the well-respected Bishop Sarah to open our event with her reflections of the first event, I would like to ask all participants to please use the chat facility, as Brother Cassius mentioned, with your contributions, as they are highly valuable to us. And if you have a question, please do write this in capital letters. And if you have a specific speaker that you want your question to be answered, please write their name as well. And finally, for those who have just joined us a few minutes ago, I would like to inform you that this event is being recorded. Now I would like to hand over to the Bishop of Shrewsbury, Bishop Sarah Bullock, who is also the chair of Transforming Communities Together for the Diocese of Lichfield. Over to you, Bishop Sarah.
Good evening, everyone. It's really good to be with you this evening. As has been referred to by previous speakers, this is one in a series of events that we're holding to try and raise awareness for people, and also I hope to answer some of the questions that you might have about the vaccination programme. The last vaccination COVID-19 webinar that we held was on the 11th of February, I think, and was a really lively event. It was very helpful to have leaders there from major faith communities, and also to have our Chief Medical Officer, Dr. Massoud Ahmed, who I am really glad to see with us here again tonight, who was able to really reassure a lot of people with some really excellent advice. So it's great to have you here again tonight. I think my reflection from the last webinar was real interest actually in some of the concerns that were being raised and some of the questions that people had. And I think for each of us, we have our own concerns and our own questions, but we're not always aware of the things that other people are facing. So for each of us, it's really helpful to be aware of the anxieties of others and to be careful and caring of others in this process. We were reminded that it's really important to listen to the scientists, to listen to the science, to be aware of what the medical evidence is that's backing up the answers that you're hearing, but also to listen carefully to leaders from our own faith communities in terms of their reflections from a faith perspective. And that was a fascinating part of the discussion last time. my own son works for the United Nations, and he works in COVID mapping globally, and also in looking at how we can prevent the spread of COVID-19 and things that we can put into place to combat that in our communities, and also looking at the importance of receiving the vaccination. And believe me, I bore him and I trust him, and I know what he tells me to be the case and how important that is for us to listen to and to take seriously the truth of what's being shared with us by the medical profession and by the scientific professions, but also to take seriously what is being shared with us by the leaders in our own communities. So I really want to encourage you tonight to ask the questions that you've got. Don't be afraid to ask those questions, and to listen carefully to the answers that are coming. But also, if you keep your eye on the chat at the side, it's just fascinating to see what people are thinking, the reflections that people are making. So I just want to encourage you to really engage with this event tonight, and all of us will get a lot from that. But it's now my pleasure to introduce our chair for this evening, Councillor Sandra Samuels, OBE from Wolverhampton Council. So I'm now going to hand over to her as she takes us into the next stage of this evening. Thank you, Sandra.
Thank you very much, Bishop Sarah, and good evening to everyone. And it's lovely to see so many individuals participating this evening. I'd first and foremost like to say a huge thank you to Councillor Rapinderjit Kaur for actually inviting me to come along this evening and participate, but also to Shaz Akhtar. At this moment in time, before I move ahead, I'd like to say to our speakers before we do start that we are going to be timing you to make sure that as you speak, you keep to your timing and keep it tight. But also, if you do answer questions at the end, please also try and make them as short and as swift as possible, but concise. One of the things we're aiming to do this evening is try and answer as many questions as possible. We've got individuals here as representative from the Ghanaian community, from the Somalian community. We have a lead vaccination nurse. We also have a GP from Wolverhampton, and we've got a medical director. Now, I don't want to speak too much about myself, but all I'm going to say is, as the local councillor for Wolverhampton, who's been part of the elected body for about 20 years, I was also the former cabinet member for public health in Wolverhampton, who worked alongside directors to set up the Health and Wellbeing Board, which is now really poignant during this pandemic. The aim of this evening's session is to improve the African and Caribbean knowledge base and various perspectives on faith and the vaccine, and to inform decision-making. That's what this evening's about. Also to provide some explanation, as Bishop Sarah said, and evidence to dispel some of these myths and fears. We've seen an awful lot of deaths among our loved ones and community members. We also want to make sure that we are promoting community cohesion and community confidence. So without further ado, because we've got several speakers, I'm going to go to our first speaker, and our first speaker is Jennifer Pearson. Now, Jennifer is the lead nurse for vaccination. Jennifer is also chair of the Chief Nursing Officers Delivery Group on the NHS England, and she's also Midland BAME Strategic Advisor to the group. I'll hand you over to Jennifer, and welcome. Thank you. Is she muted? Could someone check for me?
Yes, she is, yeah.
Thank you. I think I'm unmuted now. Thank you very much, Councillor Sandra. It's lovely to meet everybody. An absolute delight to be here. So thank you so much for asking me to speak. And I've been asked to just talk to you a little bit about my lived experience, my personal experience, and I would be absolutely delighted to answer any questions following what I have to say. So yes, I am a nurse. My background is intensive care, so critical care. I haven't been working an awful lot in critical care, but I have actually done some shifts in there. And I have to say that I have seen the devastation, I've seen the stress, the distress, I've seen the pain, and I've seen the anguish. And I've seen a lot of people that look like me that are all different ages. So this is a virus that is affecting people of all ages, so not just the elderly. So that's my nursing experience. A few months ago, I was seconded to work as a lead nurse in one of the large mass vaccination hubs. So I work out of Millennium Point or Aston Villa football ground, and I lead a team of nurses, work very collaboratively with admin staff, and we have an awful lot of volunteers who we couldn't do the job without, who are what we call enablers. So we are seeing hundreds of patients a day. Some days we are vaccinating up to 1,500 people a day. And in all that time, I can count on one hand where I have seen people have episodes of feeling a little faint. I would suggest have something to eat before you come for your vaccine. And I have had episodes where people just feel a little lightheaded. But in all honesty, in all the time that I have witnessed thousands of vaccinations, I have not seen any severe side effects. And the data tells us that there isn't any severe side effects. So I've spoken to you about my clinical experience as a nurse. I've been working in the health service for over 30 years. And this is probably the worst. This last 12 months have been the worst year of my life in the NHS. Last week we lost a colleague. He'd literally just retired. He is from the Afro-Caribbean community, and some of you may know him. And he worked in the care of the elderly department for a good 30 years. He literally just retired, and he is now sadly no longer with us. Now, I don't know whether or not he had the vaccine, but let me tell you that I've lost several colleagues. I've lost an uncle, and my dear mother had a stroke, which was life-changing. And we don't tend to put our mums and dads into homes, but we had no choice. Mum was completely needing all cares, and I agreed for her to have the vaccine. And the pushback I had from my family, I wasn't expecting. And people said to me, "You are treating Mum as a guinea pig." And I was quite shocked. I'm quite shocked at the lack of information that people are reading. I am surprised that there is the lack of trust. However, I understand the lack of trust. I understand that there have been experiments in other countries, particularly in Nigeria, and I completely understand what has happened with Windrush and the issues around lack of diversity in the upper echelons of the NHS. I understand all of that. However, we have to trust our scientists. I do trust our scientists. And loads of the things that happened in America and in Africa, those unethical studies, would not happen in this country. We are far more ethical. We have robust systems and processes. I trust the scientists. I had the vaccine. I didn't feel the needle go in. I can honestly say the first day I was fine. The second day, I did have pain in my arm. I couldn't put my bra on easily for 2 days. After 2 days, nothing. I didn't have any headache or anything like that. I feel more safe. I feel protected. I feel safe around my patients. I feel that I'm not going to die anymore. A year ago, I was writing letters to my children to say, "I love you so much, and whatever happens, this is what I want you to read," because I was so frightened. So I understand the fear, but honestly, I have read the evidence. I've spoken to learned friends. I've listened to Dr. Van Tam on the television. I've done my research, and I would urge you to verify before you amplify, before you spread the WhatsApp messages, those videos, and please verify that information is factual. Before I had my Pfizer injection, somebody sent me a video which stated that people had died following the Pfizer. No such thing has happened in this country. And there are issues with people who have severe allergies, absolutely, and we recommend that those individuals have the Oxford AstraZeneca. But in all honesty, I feel so much more protected that I've had the vaccine. And last week I spent pretty much 4 out of 5 days doing this sort of event. The fear is real. We need to listen to your concerns and we need to answer you honestly about the ingredients, about the speed at which the vaccine was produced. This was a global effort, and Sandra Bullock, who talked about her son there, incredible the work that he's doing. This vaccine was developed at speed, but no, there were no shortcuts. It was a global effort and every step has been taken. And I know that because it's what I've read and it's what I believe. And if it's good enough for them, it's good enough for me. If it's good enough for the Queen, it's good enough for me. And we will not get out of this pandemic unless the majority, if not all of us, are vaccinated. If we want to hug our loved ones in the future, if we want to get to any kind of normality, if you want to visit your loved ones in hospital, you need to have this vaccine. How am I doing the time, Sandra? Sorry.
You've got it, just a few seconds.
Okay, so I guess what I want to say to you is, please do your research. I am a nurse, I've seen the devastation, I've lost colleagues. If you look at the death toll, look at how many nurses and doctors from our community that passed. And that's because they're exposed to the virus. We don't want you to be exposed to the virus. Please do your homework. And please, before you share any of that information, think about your responsibility. Is it responsible to share that information if actually you don't know the source and you don't know how credible that source is? So I'm more than happy to answer some questions later. I can see a few in the chat, and thank you for your prayers and thank you for your condolences. And I will stay around to listen to your questions. Thank you.
Thank you very much. Thank you very much, Jennifer. That was excellent. So sorry. My condolences again for the loss of your mom. But you know, you've been honest and you've been open with us, and we do appreciate that. And that was Jennifer, our lead vaccination nurse. Before you move on, I was just going to say what I hadn't said at the start of this, that both myself and my husband has also been vaccinated, and we had the Oxford AstraZeneca, and apart from a sore arm, there's no other untoward concerns or side effects. So thank you. I'll move on to our next speaker, and I'm reminding our speakers to keep this as tight as possible so we can get as many questions as possible at the end. So I've also worked with, because we've been on a couple of other webinars together around the COVID vaccine. So I'd like to welcome Dr. Massoud Ahmed, and Dr. Masood is the Chief Medical Officer. He's the Chief Medical Officer for the Black Country and West Birmingham Clinical Commissioning Groups, serving a population of about 1.5 million. Dr. Masood is also, Massoud Ahmed, is also heavily involved in health and well-being of our communities and primary care. He's a Londoner, but he tells us that he considered himself a local from the Black Country. I think we've adopted him. Okay, without further ado, Dr. Massoud Ahmed.
Thank you, Sandra, and it's good to see you again. I was going to say that I think Jennifer has very eloquently kind of covered most of the bases. So really, I won't cover what's already been said, and hopefully that way we can focus on the questions and answers. And I think in that respect, really the reason I'm here is one, to hopefully start to build some of these bridges with the community. I think a lot of the hesitancy that we have, it's understandable. And I think one of the challenges that we have as healthcare leaders is that we can be very quick to judge, to make assumptions, to dismiss how people feel and how they react. And I think one of the things for me is that I'm very grateful that I've been invited, and I'm here to listen as much as I am to share and hopefully answer some of your concerns and discuss. I'm certainly not here to preach. I'm certainly not here to force or sort of intimidate, or the intention is not to create an atmosphere of fear and sort of scare people into getting the vaccine. I will share what we know. I will share the facts of the situation at the moment. They are very grim. We've been through a lot. But also, hopefully, I will share from a scientific perspective some clarification. I'm really glad to see that one of my colleagues, Dr. Cam Ahmed, is here. He's done a huge amount of work on the vaccination program. And I think it's good that he's here, because if I struggle with any medical questions, I'm sure he can jump in and help out. And also very grateful that a number of you have made the time to join. So I'm going to stop there and really just say thank you for inviting me, and hopefully I can help to answer some of the concerns that are raised. Thank you.
Dr. Ahmed, that's excellent. Thank you so much. We've gained an extra couple of minutes there, so brilliant. That'll add to our question and answer session. And yes, as Dr. Ahmed says, that there will be plenty of time for questions. I'm going to introduce our next speaker. Our next speaker is Dr. Amanda Chisholm, who is a general practitioner, Wolverhampton Clinical Commissioning Group. This young doctor is born and brought up actually in the city, went away to university, but obviously returned, which is what we like to hear. Amanda also, Dr. Chisholm also explains herself, or like to be thought of as a third generation African Caribbean. She's also a member of the Seventh-day Adventist faith, because just to remind ourselves, this is also about faith perspective and the COVID vaccine. She's passionate about lifestyle medicine, and she likes to make sure that she equips the individuals with the knowledge and tools to promote healthy lifestyle. I know Dr. Chisholm has also done a couple of pop-up vaccination clinics within the faith environment, but she's a GP in Wolverhampton. I think what I'd like to say is that Dr. Chisholm has also come forward now to set up a pop-up vaccination clinic at the Heritage Centre on Sunday of this week. So without further ado, Dr. Chisholm.
Thank you so much, Councillor. Hi everyone, thank you for inviting me here this evening. It's a real privilege to be able to speak to this community, one that I'm really passionate about helping. I know a lot was covered by Jennifer, and so I don't want to keep you for too long so that we can have time for questions. But I've seen as a GP the far-reaching effects of the COVID-19 virus. When I speak to a lot of people, there's a lot of concern about the virus killing people and people dying from it. And there's some people that believe that they're young with no underlying health problems, and so they're unlikely to die from the virus. And so why would they need to have the vaccine? What I would say to that is we're still learning so much about this virus. We are finding that there's far-reaching consequences and complications of having the virus, even if it doesn't take your life. I've had patients who have developed diabetes after having the virus. I have patients now who had the virus months ago, 6 months ago, and still struggling with breathing difficulties. And so although it may not cause you to die or you lose your life or anything like that, we're still seeing there's a lot of complications from the virus really taking on people's quality of life. Also, the mental health effects of, my daughter, also the mental health effects of the virus as well. I've had a young patient just the other week who is in their 20s take their own life because of the mental health effects and the pressures of being so socially isolated. So I think it is important to think about those far-reaching effects of the virus when we're choosing whether to have this vaccine or not. It's really time for us to start trying to get back to some kind of normality, bringing our communities back together. And so that's why I encourage everyone to really consider having this virus and having this vaccine, and be careful about the information that we're spreading to our family and friends if it's not being verified. If you have concerns, these are excellent platforms like this for us to talk and ask questions to those that are in the profession. And that have done the studying and able to understand the research and really give you a good grasp on it. I'm really pleased to be here today, and I'm happy to answer any questions that anybody has, but that's just another perspective on the effects of the virus and another reason why we should really consider taking this vaccine seriously. Thank you.
Thank you very much, Amanda. Thank you, Dr. Chisholm. And the fact that she's local, I'm sure people will recognize her in the chat, and I am very pleased to see you. So without further ado, I'm going to move on to our next speakers. Have you noticed I'm whizzing through these to make sure we've got sufficient time at the end for questions? So I'd like to introduce to you Dr. Ezekiel Olaitan Obileye. Pastor Ezekiel, sorry, I should say, is a Birmingham pastor. He's also from the Redeemed Christian Church of God. And he tells us that he's an independent social researcher and community capacity development and influencer. Pastor Ezekiel.
Thank you very much. And I appreciate being allowed to come here today in further spreading the message of encouraging people, particularly our people, to take the advantage of the vaccine. I quite appreciate being allowed to come on this platform today. The fact remains that we have prayed to God to see us out of what suddenly came upon humanity. It didn't come gradually, and God answered our prayers. That is the perspective that we are seeing it, and using to encourage people to embrace what God has provided as a way out of this pandemic. The misinformation is quite out there. We cannot deny that, which particularly fueled by social media. And that created mistrust. And sometimes as Christians, we struggle. Normally, we will struggle with how to reconcile our faith with the need for mercy. But when you look at not being able to take medicine on for yourself, but when you look at the impact that and the risk that you have towards the other, and God said that God is love, and if we love one another, we will not want to be a risk to another person, even if it is just for that. That should encourage Christians to want to contribute to the survival of the other person who is not able to override medicine in their own life. So we believe that vaccines are one of the best ways we can use to protect ourselves and our loved ones. And also, our community, the Black and ethnic minority ethnic groups, have been found from studies to be disproportionately affected by the vaccine. So we owe it to ourselves and to our loved ones to seek out the facts about the vaccine. And particularly for Christians, Jesus in John 9:6 put spat on the ground and used the mud to create, to heal a blind person who was blind from birth. So we are encouraging people to seek out information about using what God has provided. And two things in rounding up, two things we do, which we use to encourage people, is for factual information that you can trust about the vaccine. Don't be swayed by what the social media is peddling. And the best place to go to is nhs.uk/COVID vaccine. Somebody asked me, why should I trust NHS? That is when you are able, when you've got the capacity to make decisions. When you get to a point, you will not even be able to contribute to whether you want to go to NHS or not. People will take that decision for you. So why not rely on what can be evidenced? And secondly, yesterday I was listening to the news and I was quite fascinated by what the Fertility Society, UK Fertility Society were saying about the vaccine not being able to affect fertility as it's being peddled. So we will encourage and stand to join others to encourage people to take on the vaccine. And that is the message. Thank you.
Thank you very much, Pastor Ezekiel. That was fairly interesting, and the end of that is information that a lot of us will take away and perhaps look into. Okay, without further ado, I'm moving on to our fifth speaker, and we're doing very well here. Thank you for keeping to time. We have Adam Shabon. Adam is from the Islamic faith, Ghanaian community. Adam is also an imam for the African community, and a founder of the Huda Cultural Center. Adam, thank you.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله ثم الصلاة والسلام على رسول الله. I thank Allah for being here with important people to encourage and to motivate people with the current situation going on in the world. Alhamdulillah, as all of us, we already know, some people are constantly sending false information to scare people not to take this vaccine. But as our own Quran said, Ya wallazina amanu in jaakum fasiqun binaba'in fatabayyanu. If a disobedient person comes with information, don't just take it, but fatabayyanu, investigate that information, as you're gonna harm some people ignorantly, and after you're gonna regret. What I'm saying is, all this information that are coming in, we should pay attention, because the virus is real. The virus is real, it's there. As I know some people who lost their mothers, friends in this UK, is real. So in the Islamic perspective, all these measures that the government is taking, if we go back to Islam, the Quran is something that is Islamically. For example, these lockdowns and washing hands is being started by the Prophet Muhammad sallallahu alaihi wasallam. In his time, the same thing happened when he was alive. The first thing he said, everybody, we're going to lock down, stay at home. No one should come out. Wash your hands, cover your nose. And then Allah said, Inna Allah tahib la yuqbal illa tayyiba. Allah said he is very pure, accept anything but the pure. So when we come, you see, we need to consider the people in authority. As the Quran also said, who you believe, obey Allah, obey the Prophet, and obey those in the authority. So now the government, we've been lucky, it has come to support with this vaccine. And all this false information going through, we the Muslims, we have credible organization, bodies that we've been living our life with. For example, the British Islamic Medical Association, British Medical Association, and Muslim Council of Britain. All these Islamic organizations, they've satisfied, they give us the courage that this vaccine There is nothing around in this vaccine. There's nothing to be scared of. It's real and we should take it. So Rasulullah sallallahu alaihi wasallam, the prophet said, Allah said to him, he is the one sending all diseases in this world and he makes cure to these diseases. So we should be happy, the Muslims or all the religious community. This is our time to come together to educate others. This is not a joke. All those who bring in this false information, they shouldn't listen to the information. And I would like to use this opportunity. Muslims, we should take this vaccine very serious because this virus affected us more than anyone in my perspective. Because if we remember last year, none of a Muslim is being allowed or has been allowed to go to Hajj. Why? Because of this virus. So now God himself sent the cure, get the vaccine and we can go to Hajj and do our pilgrimage. I think this vaccine is important for we, the Muslims. I think because of time, I'll stop here. Yeah.
I'm so sorry, Adam.
That's all right.
Well, thank you very much for that. It's just that we're trying to keep it as tight as possible so we can not eat into our question time. Thank you. Without further ado, I'd like to introduce you to someone who's a very good friend of mine, but also someone who's highly respected within our community, Bishop Llewellyn Graham. Bishop Graham is fourth generation African Caribbean, a member of the Church of God of Prophecy, Jubilee Christian Center, and he's also the Chief Executive Officer of one of the largest Black organizations in the Midlands. Bishop Graham became a licensed and ordained minister of the gospel in July 1998 and been appointed senior pastor at Jubilee Church. I know this young man very well and I can't wait to hear from him. Bishop Graham, thank you.
Thank you so much, Sister Sandra, and thank you for the young there. I don't think I'm actually young anymore, but thank you so much for that. Good evening, everyone, and it's a privilege to join you this evening to talk about the COVID-19 vaccine. This is about the third webinar that I've been invited just to share my view about this on. The last two was with our own church, hosted a couple of webinars that attracted over 8,000 people listening in. So this is now gaining traction, but the reason for our engagement is really because of the negativity that we have heard and also the disproportionality in the amount of deaths being experienced in our community. But let me say the views that I will share are from my own perspective as a minister working in the community, but also as a chief executive of Nehemiah Housing Association. And as has been said, we are one of the largest BME-led housing association in the country and the largest in this region. That means that we provide housing and support for some 4,000 people in our homes, for over just 1,200 or thereabout. About a third of that are housing for people that are retired, retirement living. And of course, we know that COVID has disproportionately affected those people that are in the older age bracket. So for us, it's about a double or even triple whammy. And so I speak on the perspective of my own faith, but also as a responsible leader, responsible for the lives of others in the community. And so the health, safety, and well-being of the most vulnerable, I think has been our number one priority and will continue to be so during these days of pandemic. I also wanted just to say briefly that at the outset of this, we have been devastated in our community by the amount of people that I know we have lost. It was so shocking that after a few days, we couldn't feel numb anymore. We couldn't feel anything. It's just the body began to shut down. And in those early deaths, we've lost at least 2 of our bishops to COVID. So this is not something where our faith is going to save us from. Of course, we are people of faith and we pray, we believe in prayer and all of that. And we have been doing so. And one of my colleagues already said that this vaccine is an answer to prayer. And I also believe it is the case. So I'm speaking from that perspective as a minister. I have never, in my old 21 or so years of ministering in the community, took so many funerals in the space of 12 months. I've done more funerals in the 12 months of the pandemic than I've done in my whole 21 years of actually serving the church and community. And I've done a lot of funerals. So for me, this is not a joke. And so when people are being swayed by misinformation and malinformation, then at least as a church, we have to speak out and we have to be truthful. And of course, I do understand the concerns, and there have been many concerns, and people do have a right to ask the questions and to be given answers to those questions. But I believe that at the end of the day, that we have to go with the facts, and we also have to go with what is right and what is just. And our Christian faith speak to us about love and justice and our responsibility for our neighbors. And so, you know, we need to cooperate and be united in beating this pandemic. And the vaccine at the moment is the only source of help to get us to anything nearing normality again. So I personally commend this, and I welcome the vaccine. Our church has not yet made a public statement on it, but I think we're preparing to do so. But personally, I can speak for myself that I've had the vaccine. I too have had, after day 2, a little bit of sore arm and felt a little bit of a temperature, and just lie down and drink lots of water, paracetamol, and I was okay within a couple of days. That has been the symptoms, and I'm told that that's just the effect of the vaccine working, and I've had that, and I'm perfectly fine. So I'm here to support and answer any question that you may have around faith. There's nothing in our faith and in the Bible to say that we should not take the vaccine. And so without further ado, I want to hand back over to our host, and looking forward to your questions.
Lovely.
Thank you, Sandra.
Thank you very much, Bishop Graham. That's excellent, and you're going to be here to answer some of our questions, and even those around some of the socio-economic aspects of and impact of COVID. We are doing very well here. We're on our last speaker, our 7th speaker, and our 7th speaker is Saheed Odowa. Saheed is also a family support coordinator from the IYES Community Association. And just to say that we're doing extremely well. So Saheed, you've got about 3 minutes. Thank you.
Thank you so much. Thank you for having me. I will speak about 2 points. The first point being my experience for the vaccine. I had my vaccine on the 17th of March, and the vaccinators kindly allowed me to take a video clip of myself taking the vaccine. Then as a community, we have circulated my video clip to the community. And as a result, I received a bombardment, a barrage of calls from the community asking how I felt, what I felt, if I was there, and so on and so forth. And I was telling them that I didn't feel anything other than a pain in my armpit and swelling of my glands in the armpit for 2 days, which have eventually disappeared. But I made a follow-up and I contacted some people, some elderly people, and I asked if they have taken the vaccine. And they said, no, we didn't take. And when I said, why? You have seen me taking, why didn't you take it? The main reason for all of them was that their young children and grandchildren stood the way of taking them the vaccination, and they discouraged them because the myth against the vaccine is mainly lies within the young Somali community, as the Somali community. And I may say the elderly people in this community are hostage to their children and young people who are very much against the vaccination. And when you ask them why, they tell you all reasons like social media, misinformation, this is man-made, some people want to make money out of it, some people want to control the population, and so on and so forth. The problem this community has is that the young people are very much against the vaccination, and many elderly people or older people are not taking the vaccine as a result. The older people don't mind to take the vaccination because they have witnessed a lot of loss in the community, especially elderly people or people with underlying health problems. The other thing, back home, we are receiving day-to-day calls that Mr. Eggers died, Mrs. Eggers died because of COVID-19, and the older people are facing a lot of fear. But again, they have been brainwashed, if I may say, by their younger children and the grandchildren. And that's an area, as a community, we would like help in order to engage young people in these discussions. And that is something we would like to speak to any parties, all parties who are interested in doing something about this myth. Thank you.
Okay, thank you very much. That was excellent. Can I just say, Saeed, that was great.
I'd just like to remind you all, as I mentioned in the beginning, that this was the second event in its series. Our third event will take place on Thursday, 25th of March. So if you know anybody who still has fears, anxieties around the vaccinations, please do encourage them to join us. Our third event will also be focusing on our hard-to-reach communities, such as our Polish communities, Gypsy, Roma, and traveller communities. So if you know anybody from there, please do share the event when it comes your way. Thank you very much for joining us, and the platform will stay open for a further 10 minutes because I can see a hand raised, but it will only be for 10 minutes because I do have another meeting to go to at 8 o'clock. So thank you very much for attending.